Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Hormones. Hypothalamo pituitary ovarian axis. Hypothalamus contains arcuate nucleus of hypothalamus releases gonadotropin releasing hormone at puberty. Gonadotropin releasing hormone is a decapeptide. The half-life of gonadotropin releasing hormone is a decapeptide. Half-life of gonadotropin releasing hormone is 3 to 4 minutes. Gonadotropin releasing hormone is released in a pulsatile manner. It acts on anterior pituitary to release the gonadotropins, that is luteinizing hormone and follicle stimulating hormone. Gonadotropin releasing hormone receptors are membrane bound. The neurons which release gonadotropin releasing hormone are derived from olfactory placode. Then these neurons migrate from the olfactory placode to the hypothalamus in close association with olfactory nerve. So if there is any defect in the neuronal migration, it results in Kallmann syndrome. Decreased gonadotropin releasing hormone with anosmia are the clinical features of Kallmann syndrome.
thank you and thank you for watching.